Good morning, afternoon, or evening, teacher. Our team will talk about the diabetic patient, from what it is and his nursing care. This team is made of Camberos Castillo, Tania Giselle, Sierra Villa, Sheila Michelle, Sánchez Mejía, Alexa Rubí, Tranquilina Barrera Fabiola, and Verdugo Navarrete, Carla Michelle.
What is diabetes? Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Hyperglycemia, also called raised blood glucose or raised blood sugar, is a common effect of uncontrolled diabetes, and over time leads to serious damage to many of the body systems, especially the nerves and blood vessels. Symptoms: polydipsia, polyuria, blurred vision, fatigue, losing weight unintentionally. There are three types of diabetes. Type 1 diabetes is characterized by a deficient production of insulin and therefore requires daily administration of insulin. Neither its cause nor the means to prevent it are known. Gestational diabetes. Gestational diabetes is hyperglycemia with blood glucose values above normal, but below the diagnosis of diabetes. Gestational diabetes occurs during pregnancy. Type 2 diabetes affects the way the body uses glucose for energy. It does not allow the body to use insulin properly, which can result in high blood glucose levels if left untreated. Gestational diabetes. Women with gestational diabetes are at increased risk for complications during pregnancy and delivery, and these women and possible their children are also at increased risk for future type 2 diabetes. Type 2 diabetes. Factors that contribute to the development of type 2 diabetes include being overweight, sedentary lifestyle, and genetics. It is common that type 2 diabetes can be prevented.
To continue with the topic and nursing intervention, we have the following. Nursing intervention. Nursing who have correct knowledge about diabetic can contribute significantly to education diabetic patients with the current information they need to manage and care for their condition and healthcare and community setting. Continuing with the topic, we have to therefore nurses must be equipped with in-depth knowledge of diabetic care and management and regularity as scenes. For such knowledge to provide appropriate counseling and education for diabetic patients.
The nurse is responsible for training, teaching, and supporting people who suffer from the disease. The diabetes nurse performing the following function: it helps them understand and treat their illness, to make decisions regarding diet, since your daily dose of insulin will depend on your carbohydrate serving, and he teaches them the injection technique. When the patient cannot go to a hospital, they are serving some other means. It gives them instructions throughout the event of complications and provides training course and workshop. The nursing specialist is responsible for diabetic education and care to facilitate self-care in diabetic patients.
Reduce morbidity and mortality due to diabetes mellitus, and as a fundamental objective, raise the quality of care for this type of patient.